COVID-19, coronavirus, day 42. More than 1,100 dead and 46,000 people infected. Cruise ships quarantined. Armed forces mobilised. The speed of the virus, led by the person-to-person infection, grips the world. Cases are being found in countries all over the globe, but with a 2-week incubation. Are we too late already? Here, at the Dark Lounge, we discuss what might happen. Illness and disease have wiped out families and tribes since the beginning of humankind. Contagious diseases such as smallpox and measles have devastated communities, from Native Americans to isolated tribes in the rainforests of the Amazon. We delve into history to understand the scope and fear an outbreak can create. In Kyrgyzstan in the early 1300s, the grasslands were dying. The long, hot summers had taken their toll and destroyed the crop. The barren wasteland left nothing for the animals, and even the rodents struggled to survive. The newly formed towns and cities provided an abundance of food compared to the lifeless grasslands, and soon an invasion would occur. However, these unwelcome guests also brought even worse visitors with them. Disease-infested fleas with an appetite not just for animals. The bites would fill the bloodstream with so much nasty bacteria, the immune system would crash. Toxins flooding the body and causing septic shock where blood vessels began to leak and organs fail. Fever would set in, causing muscle cramps, seizures and gangrene in the extremities. Death would soon follow. The local population soon became ill, but with starvation and famine rife, the need for travel was key for survival. The disease spread, killing those in its wake. With the Mongol hordes covering the Far East, invasion and trade would take the disease into the heart of China and also along the Silk Road towards Europe. Estimations of the deaths caused by the Bubonic Plague range from 75 million to 200 million people. Such chilling numbers are hard to imagine, but to place in context, half of Paris's population was wiped out. The Black Death did not discriminate by wealth or class. It devastated the populations of Europe and Asia. This may seem a problem of the past, when medical science was in its infancy, but more recently. In 1918, after the ravage of World War I, another pandemic hit Europe. This strain of influenza, known as the Spanish flu, spread quicker and faster than ever before. As soldiers, sailors and civilians returned home, the disease spread quickly and further around the world. This time, the disease had made it across the Atlantic to America. Approximately a third of the world's population was affected. Death touched every part of the globe. This strain of influenza infected more than 500 million people. Everyone from the young to the old. No one was safe. Death tolls ranged from 50 to 100 million people. The Spanish flu killed more people in the first 24 weeks than HIV or AIDS did in 24 years. Medical science now studied the disease, and the World Health Organization knew now this would not be a case of if, but when it would strike again. In 2009, the world faced a new pandemic. Swine flu. This was a new strain of the H1N1 virus, an amalgamation of multiple viruses combining with the Eurasian pig flu virus. Flu-like symptoms would soon develop into pneumonia or acute respiratory distress syndrome. Seemingly healthy people would struggle to breathe and high fevers would take over the patient. The world's population would be struck down again. By May 2010, the virus was in decline. Swine flu had claimed approximately 284,000 lives, with more than 20 million infected. Some people still believed that the danger was exaggerated to increase drug company profits and to increase fear and confusion in the general public, to control and bewilder. Coronavirus is named after the Greek meaning crown or halo. The viral spikes allow the protein to replicate and cause upper and lower respiratory tract infections. The worry is always the combination with animal viruses which the human body struggles to cope with. Those exposed to the person-to-person virus are living in fear of repercussions. By lying or hiding from authorities, have these victims become super spreaders of the disease? Wuhan has a population of 11 million people and is the largest city in the Hubei province of China. Some believe that the source of coronavirus came from a seafood market where the Chinese delicacy of bat has been blamed, but not proven. Could nature be fighting back? The city is now locked down, but it is suspected that in the mass panic, possibly half the population of the city fled before the government could enforce the quarantine. In December 2019, Dr. Vening noticed that 7 patients in his care shared symptoms of a virus that looked like SARS. He highlighted it to his superiors, but was accused by the Public Security Bureau of making false comments and trying to disturb the social order, and arrested. On the 30th of January 2020, it was confirmed Dr. Vening was the latest victim of coronavirus. The world is racing to find a cure, but best predictions see this still not being available for months. Globalization is a word often used in relation to the growth of the human race across the world. It is used to describe economic growth, communications and travel. Our society and economy has changed with trade, technology, warmongering and displacement of whole communities. Mass populated areas are now common. People now live within feet of each other, rather than in rural areas where miles of fields would separate them. However, when we look at globalization from the perspective of a deadly virus, have we created a global highway leading to our own destruction? Wuhan Institute of Virology was founded in 1956. Focusing on microbiology and virology, the institute has had many successes over the years. Some of its greatest achievements have been made in the animal origin studies of SARS and avian influenza viruses. Current studies have focused on bats as a natural host of various viruses. The immediate reaction to silence Dr. Vening may seem odd. Was there an underlying reason? An outbreak that no one in power wanted people to locate back to its source? If we use COVID-19 as a test, a measure of the impact and speed a virus can move and reach the far corners of the world, are we looking at a war game unfolding in front of our very eyes? A silent weapon of devastating impact, defeating enemies and undermining nations. A cruel weapon targeted at overwhelming health systems and indiscriminately killing across the planet. A weaponised virus such as Ebola, with a mortality rate of 90%, could ravage the planet. Released into the general public, it could be spread quickly and wreak havoc. The coronavirus outbreak is a warning, a test of the world authorities to manage and protect their people. We can pray for those struck down and hope that we have systems in place to protect the citizens of the world.
Everyone says, hey, according to the schedule, we should be on the deck at 11:57.
Broken cloud 1300, broken 1500, overcast 1900. Take off.